The Albanese Government has committed more than $24 million to establish the Northern Territory's first standalone medical school. The facility at Charles Darwin University will give priority to aspiring Indigenous doctors and students from the NT.
Breaking ground on a groundbreaking project.
This medical school is about us setting ourselves up for the future.
The federal government will commit more than $24 million in next week's budget to help Charles Darwin University establish the Northern Territory's first standalone training facility for aspiring doctors.
From 2026, we will be able to see these doctors graduate from this university in terms of a medical school.
Aboriginal people in the Northern Territory suffer some of the worst rates of chronic disease in the world. That's something the new school hopes to combat.
We know the issues here in the Territory. We know the issues for Indigenous people all across this country. We know the low statistics around the morbidity and the mortality rates.
The school will have a particular focus on training local students.
First priority, Northern Territory First Nations students. Second priority will be Northern Territory residents, and then if there are any places left, we'll take First Nations people from the rest of the country.
The reason why I want to study here is because I'm close with my family, and being able to learn medicine here and then give back to my community.
It's hoped this will reduce the Territory's reliance on fly-in, fly-out medical staff.
And so it's not about medical tourism from the big city.
Charles Darwin University expects this new medical school to be up and running by 2026. But Professor Di Stevens says that opening date could be sooner if it can get some extra cash. That's something for governments to ponder as regional and remote areas find it harder and harder to find a doctor.
We are desperate for medical workforce across the board. So it's in the hospitals, it's in the Aboriginal controlled community sector, and it's in general practice.